Hi, everybody. This is Dr. Harry. So, I've been getting the question today. So, what is up with the CDC's latest guidelines? In fact, many of my physician colleagues are not happy about these new guidelines at all, and they're having a really hard issue with them. Some of my patients are also not happy with these guidelines. So, what are these guidelines, and such why are they causing us to feel so upset? Well, here's the new guidelines that I believe was listed yesterday. And basically what they state is that if you have been in contact with somebody with someone who has a positive COVID test or has had COVID-19, if you're asymptomatic, you may not necessarily need to be tested. Now that seems really contrary to the previous recommendation that they've had before, which really recommended at that time that anyone who's been in close contact for longer than 15 minutes with someone who has been diagnosed and has had COVID-19 should be tested so that they can be isolated so we can reduce the spread of this virus. Now, this seems to be in direct contradiction to that previous recommendation. So this is basically the concern. The basic concern is that we have learned about the virus, that it is possible for people without symptoms to pass the virus on to someone else. And that person may not be as lucky as the person with no symptoms. So that person has the potential to develop significant symptoms and complications. And so the concern is that this may be able to help the virus to spread more easily, because if we're not testing asymptomatic individuals who have been in direct contact with people who have had this virus, then are we putting more people at risk for contracting this virus? Now that is the question that needs to be answered. So far, we have not heard the CDC's opinion on these concerns, so we will wait for these opinions. However, at this point, at this point, I still feel strongly that if you have been exposed to, for an extended period of time, for someone who has COVID-19, who has an active case of COVID-19, you may need to be tested, especially if you have people in your lives who are at high risk for complications, or especially if you have a job requirement that puts you into direct contact with susceptible individuals. So this is my opinion on this current recommendation. Again, I wait to hear what the CDC has to say in terms of why this current recommendation was made. And so I think many of my colleagues agree with this. So tell me what you think. What is your opinion on this new recommendation? How do you feel about it? Feel free to leave a comment as to how you feel about it, and let's have a discussion. So until next time, this is Dr. Harry. Bye-bye.